Good morning. I'd like to introduce Joseph Giovannetti, Director of the Bureau of Investigations Division of Legal Affairs for the New York State Department of Health. We ask that everyone silence your cell phones before we begin. This is scheduled for 1 hour. We'll be ending at 11 o'clock.
All right, thank you very much. Can everyone hear me okay in the back? All right, great. So good morning, my name is Joe Giovannetti. I am the Director of the Bureau of Investigations at the New York State Department of Health. I want to also acknowledge we have my staff here in the front row, or the second row, my three investigators, Investigator Cruz, Investigator Person, and Investigator Gill. And we'll talk more about, kind of where they're located and the different roles that they play throughout the investigation. But I appreciate them being here, and I appreciate you all selecting this talk this morning. So we can go to slide number 2, please. So just to give you a quick synopsis or a quick preview of what we're going to be discussing and what the presentation is going to include this morning. So I'm going to give a brief intro to our Bureau of Investigations. As we'll talk about in a couple minutes, we're relatively new. We've existed for the last 2 years. We're celebrating our 2-year anniversary right now. Thank you. Thank you. I appreciate that. So we'll talk a little bit about what we are. We consider this somewhat of a coming out party where we're introducing ourselves and the work we've done. The significant work we've done in the last 2 years, to the larger public safety community throughout New York State. We'll talk about our history. Where did we come from? A big part of that is work that we did during the pandemic and in our kind of prior iteration, which was as a vaccination complaint investigations team. We'll talk about that and the work we did there. We'll talk about some of the work we're doing right now, the current work we're doing, and some of our early successes. We'll talk about what's next and what are the priorities for our team and for the Department of Health in terms of working with law enforcement throughout New York to address significant or substantial public health concerns. And then we'll give you all of our contact information and invite you to reach out to us, for information sharing, collaboration, those kind of good things that we're all hoping to get out of this symposium this week. So what is DOH's Bureau of Investigations? What are we all about? So we were, like I say, established 2 years ago in fall of 2023. Our mission statement is that we are responsible for investigating fraud, abuse, and criminal misuse of programs and systems administered by the Department of Health and enforcing against other high-priority threats to public health and community safety in New York. We're distinct from other investigative teams within the Department of Health and within the broader public health community in New York that some of you may have worked with or be familiar with. So, we consider these our sister investigative teams, but they're not us. So you're familiar with the Bureau of Narcotic Enforcement. They enforce under Article 33 of the Public Health Law. The Office of Professional Medical Conduct, they do investigations with regard to physicians and physician assistants. They do professional disciplinary hearings. That's not us. But of course, we work closely with both of those teams. And then OMIG, the Office of the Medicaid Inspector General, does enforcement and investigations with regard to Medicaid. That's something we don't do. We don't do anything Medicaid related. We would defer entirely to Medicaid, or to OMIG, I'm sorry, for that kind of work. Our team was modeled after the department's COVID-era vaccination complaint investigations team, and we'll talk more about the specific work that that team did. But that was really our proof of concept, where we did some substantial work, some significant work with other law enforcement throughout New York during the pandemic. Specifically with regard to fraud around the vaccine program, the state and the CDC's COVID-19 vaccination program, We are a very, very small team. We're made up of 4 investigators plus me. We also have an administrative assistant. We're split between Albany and New York City. And so we have 2 investigators up here in Albany, 2 in New York City. Very roughly speaking, or generally speaking, our folks down in New York City jurisdictionally cover the city, the 5 boroughs, Long Island, and Lower Hudson Valley. And then the poor folks up here in Albany cover the rest of New York State. But we work in a partnership model, so it was important to us, given that we only have 4 investigators, to be in 2 locations. And as necessity is the mother of invention. I think because we're so small, we really, and we'll talk more about this, we really subscribe to a lot of the kind of things that are going to be discussed at different symposiums throughout, or different presentations throughout this symposium. Really targeted investigations, being very selective with regard to the kind of cases we bring, doing a lot of thinking and a lot of data analysis around what cases are going to have the biggest impact on the public health concerns that we're trying to address. And like I say, part of that is out of necessity, given how small we are and how limited our resources are. Obviously, something we all think about in the different contexts, limited resources and how to maximize them, to achieve our respective missions. So, unlike most investigative bodies, even some of those sister investigative bureaus or units within the Department of Health, we don't have any particular statutory mandate or funding source that dictates what it is that we can investigate. In short, we were designed to investigate whatever and to bring enforcement actions and whatever the top priorities of the Department of Health from a public health perspective are at any given time. So we're designed and intended to be somewhat nimble. So right now, today, there's certain priorities that we are concentrating on, and we'll talk about those throughout this presentation. I might give this presentation 2 years from now, and the priorities might be completely different. And again, that's by design and an attribute of our team. But what are our real, what are the authorities that we can point to for our work? These are the primary ones. So under public health law, the commissioner is responsible for enforcing public health law. So at the end of the day, our hook in any of our investigations or any of our enforcement work is the public health law itself, that body of New York State law. We have a subpoena power, which which we use a lot. That's really, from my perspective, my background is as a prosecutor. That subpoena power is really the key to our investigations and is what allows us to do, more sophisticated white collar, fraud investigations. And an interesting component of the public health law, which I think is underappreciated and people don't really understand, is that there's a catch-all provision of the public health law that makes any willful, or generally any willful violation of the public health law a criminal violation. It makes it an unclassified misdemeanor, punishable by up to a year in jail and $10,000 fines. So at the end of the day, the entire public health law, under the right set of circumstances, really is a set of criminal laws if violated. And then, of course, when we're so that's our investigative hook. But of course, if we find violations of penal law, then those are things that could be part of our investigative work as well. So just a little bit of background about me. The general counsel, Kathy Marks, and I really designed the unit and created it, and over the last 2+ years have done all the hard work of birthing it, right? So really, in a lot of ways, the Bureau is a reflection of our background and where we come from. Kathy Marks was a former AUSA and SDNY, and here's my background. I'm a former ADA at the Manhattan DA's office. That's where I began my career. I then came up upstate and was an AUSA in the Northern District of New York. And just prior to this job, or to coming to DOH, I worked for the commissioner at the Department of Transportation. And I think it is helpful. We won't spend too much time, but looking at each of those experiences and how they really have contributed to how we have designed our team and what we think about and how we view the work that we do. So starting with the Manhattan DA's office, I was one of the first classes that was hired by DA Vance about 10 or 15 years ago. And now we take it for granted, but at the time, he was really on the cutting edge, and the Manhattan DA's office was really on the cutting edge with regard to intelligence-driven prosecution, using intel, modeling what they were doing from a prosecution perspective on work that NYPD was doing with CompStat, really kind of using data to drive how cases were being prosecuted. And so that was really the environment, that I started and grew up in from a criminal justice perspective. That's really something that's very important to us. Like I said before, in part out of necessity. Such a small team, we really have to use our limited resources intelligently, and we do that by thinking long and hard, looking at the data, what are the cases we're going to bring, what are we going to do to maximize our impact in the areas where we're trying to do that. And then separately, a big case that I prosecuted while I was at the DA's office, kind of a goofy case, but was people base jumping off of the World Trade Center. And I think from that experience, what I took from that experience was learning how powerful, the media is, right? At that point, we were going back to like 2014. Social media was just coming into vogue, kind of universally. And I think the DA's office understood, from very early on, the impact that would have in terms of things like general deterrence, and how we could use cases and the press around cases to send messages in ways that you really may not have been able to before. Now, with Facebook, with all kinds of social media that a lot of us don't even know, right? We'd have to talk to our kids about it. But there's literally, thousands of editorials on some of our cases, being drafted every day, by members of the public, and those are being read, they're being discussed, and I think, thinking long and hard about the impact that has on, deterrence, on maximizing or amplifying the impact of the work we do is really something that, was a lesson I learned early on, and is something, we think a lot about at the Bureau of Investigations at DOH. The U.S. Attorney's Office, I had the privilege of doing some cases, some misbranding cases, working with FDA, working with HHS-OIG, and I realized that those cases, even though they look somewhat differently, at the end of the day, those are really public health cases in a very direct way, right? So this was a case I did from a doctor who was using misbranded, foreign, unapproved cancer medications at his oncology practice. And, at the end of the day, kind of a white-collar case, a lot of record analysis, looking at medical records, looking at his order history, these kind of things. But what was at the heart of that crime? It was really taking advantage of people who were particularly vulnerable, right? These were cancer patients who trusted their doctor, particularly with cancer medications, right? A lot of it is being administered through chemo. It's unlike a medicine that you would go to a pharmacy and look at and have an opportunity to review yourself, even if you did have the knowledge or the expertise to be able to do that. These are medicines that the patient 9 times out of 10 is never actually seeing the bottle, never really seeing where they're coming from or anything like that. So it's really, taking advantage of particularly vulnerable people, especially this practice, maybe true of any, most cancer practices or a lot of cancer practices. A lot of the patients were elderly. Again, people who trusted their doctor to be doing the right thing. They were being taken advantage of for financial reasons, right? The foreign unapproved drugs were cheaper than drugs that had been approved and, purchased through, the proper chains of distribution. And it occurred to me at the time, it still occurs to me, that that's a lot like, kind of what we think of as the classic public health work, right? So this is work I did back when I was a student in Nairobi in Kenya, where we were working on creating, this was using SMS, like simple kind of old-fashioned text message technology, but we were working on creating a system by which you could check for counterfeit malaria drugs, anti-malarial drugs, by plugging in information from a drug into a text messaging system using a simple old-fashioned phone, SMS text messaging. Remember, you used to have to go through and create or shuffle through to get the letters, and it would take forever to send a text. So that's what we were working with. This was about 15 or 20 years ago, and but what we did was we went and we did a lot of research, not dissimilar to investigative work, in the field, and we found that people were doing very similar things to what this oncologist here in New York State was doing, right? They were selling the name brand drugs, they were selling the generic drugs a little bit cheaper, and then for people who couldn't afford either of those, they were selling the counterfeit drugs. And I think in a very real sense, they didn't understand, they didn't necessarily understand the implications of that, what that meant. There was a market for it, especially in a particularly poor community, impoverished community. But at the end of the day, obviously that was creating very, very serious public health consequences for the people who were, the victims of those, of those sales of those counterfeit drugs. And then finally, the work I did at DOT. So when I came to DOT, we were having a lot of problems at the time, a rash of what we ended up calling work zone violence incidents. So these would be cases in work zones on highways where folks were being assaulted by angry drivers. We had a case where somebody was hit by a paintball gun. Another case where somebody, one of our workers had hot coffee thrown at them, all kinds of things. And this was rising in addition to, kind of more classic or traditional incidents of work zone intrusions or work zone deaths where people were, workers were being killed in work zones. So, one of the projects that I was given from very early on at DOT was how do we address this? And, and a lot of what we did was work that we really try to emulate with the Bureau of Investigations, which is building strong partnerships with stakeholders throughout the state and what that really looks like. You can go to the next. So at the end of the day, we were meeting with DA's offices, we were meeting with law enforcement, and these weren't just kind of handshake meet and greets. I think that's what it started off as. But then we came to realize, that was nice enough and it made everyone feel good, and it was something for us to talk about. But at the end of the day, it really took, getting the experts who were in the field, really understood what these kind of incidents looked like, how they played themselves out logistically, sitting around and really working through and troubleshooting, how we would address it at a statewide level. So just, very quickly to give you a sense, right? A lot of what we were dealing with were, workers who were out in, in a work zone. So when you're in a work zone, and an incident like that happens, who's responsible for calling, for calling 911? If it's a bunch of different people, it starts to get chaotic. So, so we would have, we would work through designating whose job that was. Even with calling 911, we really wanted to work with state police. We had strong relationships with them through our TIM teams, but we were told if you call 911, excuse me, they're going to send, thank you, they're going to send, whoever's closest. And so, that looked like, really figuring out how to work through that. With regard to incidents where it would be just a violation as opposed to a misdemeanor or a felony offense, some of the troopers or other law enforcement who would show up at the sites were under the impression that, because they hadn't witnessed the incident, they would not be able to write a ticket, that they would only be able to, write up or make an arrest for a violation if they had witnessed it. That, in fact, isn't true legally, but we had to work through it logistically and figure out, protocols and, even what the forms would look like. And then, ensuring law enforcement that we would play our part, right? And that, if they needed, witnesses for court appearances, things like that, if they needed statements, it wouldn't be like herding cats, right? That we would, be Johnny on the spot, and we would get them who they needed, what they needed right away, make it as easy for them as possible, to work with us and bring those cases. And that work really culminated and really paid off. Can you go to the next one? Great. In response to this real tragedy that happened while I was at DOT, well, one of our workers was killed by a truck driver in Tioga County. Literally, within hours of his death, he didn't die immediately. He was taken to the hospital and then succumbed to his injuries, unfortunately. Tragically, I was on the phone with the district attorney, making him aware of what happened, making him aware of all the resources we had available to him so that he could do the investigative work necessary. And he ended up, to his credit, bringing a very, very difficult criminally negligent homicide case. He got the conviction, which was a huge deal. Unfortunately, it was overturned, kind of a sad coda. It was overturned on appeal under New York state law, nothing that he did wrong. But again, for the purposes of this discussion, I think it was kind of a stellar example of the work we had done before the incident, right? To build the relationships and to set up the protocols around what that would look like, what that relationship between us, law enforcement, and the DA's office would look like when something like this happened, and we were able to, put it into effect immediately, and it paid off, with a very difficult criminal conviction at trial. So, like I said before, our prehistory, before we started as a permanent full-time bureau within the Department of Health was as the Vaccination Complaint Investigations Team. This was a ad hoc task force that was set up during the pandemic. It was coincided with the rollout in December of 2020. We started in January of 2021 to the rollout of the COVID-19 vaccine throughout the state. You'll remember, there was a very, very prescribed set of rules around the vaccine at the beginning. Only certain people could get it at certain times. You could only get it from certain providers. If you belong to one class, you could get it from one set of providers. So for example, certain types of people could only get it from a pharmacy. Others could get it from doctors, healthcare professionals. There were all these rules around it. And the idea was, that folks were, we witnessed or we understood from early on that there were going to be incidents of folks, trying to bend those rules or, failing to comply with the rules around the program. So the team was really set up in the first instance to address those issues around people wanting to get the vaccine. Very early on, in that summer, we started to see a significant shift where, you started to see fraud around people claiming to get the vaccine when they really weren't getting it. And from then on, that's primarily what we worked on as a team. Again, that was, what we consider our predecessor and our proof of concept. As the Vaccine Complaint Investigations Team, VCI, we had a team of 5 sworn investigators, peace officers. They were seconded to us from the Bureau of Narcotic Enforcement within DOH and the Department of Financial Services. It existed for, and I led that team. It existed for about 2.5 years. So throughout the, again, from January 2021 to the end of the public health emergency, the end of the pandemic. And in that time, we did an incredible number of investigations, 800 investigations. Most of our investigations were based on complaints that would come to us through a hotline that we set up and advertised, being run by Tax and Finance. And we also had an email address, Stop Vax Fraud, that we used and got complaints that way. That email address is actually still in existence. We've just repurposed it for school vaccine fraud or pediatric vaccine fraud, and we'll talk more about that later in the presentation. So in the course of that VCIT work, we did a lot of first of their kind investigations, stuff that had never been done before. Why? Because none of us had lived through a pandemic or addressed some of the fraud and other public health and law enforcement issues that would come up around the administration of a nationwide vaccine program. We partnered with FBI, HHS OIG, New York State Police, and local and state and federal law enforcement agencies. And we had a lot of success, dozens of arrests and convictions. And in fact, some of the work is still being wrapped up. We just had a doctor arrested and convicted as part of a plea deal. He got a violation by the Manhattan DA's office in a case that we did with New York State Police, a COVID-19 vaccine fraud case, that we had been investigating for years. So one of the big cases we did was actually the first vaccine fraud case, as far as we're aware, anywhere in the country. We did this with the Manhattan DA's office and state police and U.S. Postal. This was a case out of New York City involving the sale of fraudulent COVID-19 vaccine cards through Instagram. It resulted in 15 arrests, 15 indictments, and approximately 15 convictions. So this is that case. So the primary suspect was an exotic dancer out of New Jersey who had an Instagram account called Anti-Vax Mama. She was selling cards for $200, fake cards for $200 a pop, and pretty openly advertising them on Instagram. She hooked up with Miss Barkley in the top there. Miss Barkley was like a low-level medical assistant at a medical practice in Long Island. What she brought to the scheme, or what she brought to the table, was the ability. She had access to the New York State Immunization Information System, which is what records any childhood vaccine that's administered in New York State outside of the 5 boroughs of New York City. And at the time, any COVID vaccine administered to anybody. So for a bump up for extra money, you could pay to have the information on the fraudulent card that you purchased from Anti-Vax Mama entered into the database, and thereby make it harder to detect the fraud, make it more authentic. We were very happy, privileged to, honored to receive Investigator of the Year awards from the Federal Law Enforcement Foundation, along with the Manhattan DA's office team and the state police team and Postal Service team that worked on that case. So it got a lot of attention, a lot of press, and was kind of a big foray into this area of vaccine fraud and what that looks like and how to combat it. This real public health concern, and how to combat it through kind of traditional law enforcement investigation, white collar investigation, and prosecution. A couple other cases we worked on with FBI, specifically with the New York City Healthcare Fraud Task Force. Sage Fem or FOM, I've never known how to pronounce it, was a midwifery based up here in Albany, and they were they were an enrolled provider in the vaccine program. Remember, the objective of the vaccine program was to get as many needles and as many arms as possible throughout the states or throughout the country, right? So there was not a lot of work being done on the front end to audit or to review applicants to the program. It was really kind of an equivalent of like the phrase pay and chase system. Give the money because the money needs to go out quickly, and then where there's fraud, we'll chase it down. And that was kind of the same idea with the vaccine program. So this was a practice of midwifery. Obviously. An anti-vaccine, had anti-vaccine sentiment, and what they were doing was having vaccine allocated to it. They would destroy the vaccine and give fake vaccine cards to folks. A lot of the folks who they were servicing were from New York City, which was a way in which we first caught on to the fraud. People were also coming from, or purportedly coming from, Canada. So that case was prosecuted out of EDNY, the Eastern District of New York, successfully prosecuted. There's another case, Healthcare Logics, going back to that other slide. Thanks. Healthcare Logics, kind of a strange case. They set up a real business, or at least a shell business, in New York City. They were doing a lot of COVID testing, like fake COVID testing, where you could get from them basically, whichever you wanted. Like if you needed to show that you had COVID to get out of work or something like that, you could get a fake positive test. And if you needed to show you didn't have COVID so that you could travel or something like it, you could get a fake negative test, COVID test from them. But they were also doing, particularly to students at different universities and colleges in New York City and Lower Hudson Valley. They were selling fake vaccination cards to them, and that case was prosecuted out of SDNY. Another big case, and this goes back to what I was talking about before. One thing we're always thinking about is how do we maximize the deterrence value of the cases we bring, right? And part of that is through working with press and finding cases that are going to, or more likely, to get the attention of media and thereby, amplify the message. So this case, in a way of looking at it, was, a minor case, but in another way, dollars to donuts, I would bet that this case had more of a deterrence effect on, the public health issue of creating fraudulent vaccination cards, fraudulent proof of vaccination than, any number of other cases that we brought at the time, given what it was all about, right? So this is a case where you'll remember, or maybe people generally aren't aware, especially in this part of New York, but Highmark Stadium, where the Buffalo Bills play, had a private vaccine mandate that season, right? So you had to be vaccinated to be in the stadium. You had to show proof of vaccination to get into the stadium, and so you can imagine. There were all kinds of folks who were coming in with fake vaccination records. They really had no way or no real way of checking it at the door. So one thing we did was you can go to the next case. This was largely a social media case. So this was actually based on a complaint, an anonymous complaint. But somebody told us that this particular season ticket holder was going into the stadium with fake vaccination cards. We looked at their social media history, started the season off right in September, weren't too happy about it, but they were selling their season tickets because they didn't want to get vaccinated. later in the season, things get more exciting. The Bills are doing really well, and things change. So it starts going to the games in December, and then that's a social media post from the day that he was arrested at halftime, sitting in the stadium with his fake vaccination records, having gotten into the stadium. So you can go to the next slide. So we worked with the Bills. We worked very closely with them. The Sheriff's Office, Erie County Sheriff's Office, which has jurisdiction over Highmark Stadium. We worked with Erie County Department of Health, and we brought a case. District Attorney Flynn, I understand, never shied away from a press conference. So he was game. He held a press conference at the arrests, after the arrests, and you can go to the next slide. And we got, the case got a lot of attention. Why? Because, it had to do with the Buffalo Bills, the biggest game in town, in Western New York at least. It was press from CNN, press from USA Today, any number of news outlets. And again, in part by design, a case that we hoped would really have a deterrence effect on, a huge public health issue at the time. Folks, using fraudulent vaccination cards to get into bars, concert venues, restaurants, gyms, all kinds of things. So this was one of the biggest cases that we brought, and it continues to be a case that we put a lot of attention on. This is Wild Child Pediatrics. It's a case out of Suffolk County. A nurse practitioner had an absolutely huge fraudulent vaccine practice during the pandemic with COVID vaccine. She made over $1 million. Just to give you a sense of kind of what we're talking about. We'll talk a little bit more about that. Over $1 million, so this is real money. I mean, I think some people have the impression, that that a lot of the people who are going after or that are providing fraudulent vaccines are, true believers, and that may be true in some cases. It may not, but at the end of the day, in almost every case, these frauds are real in terms of dollar amounts. They're making huge amounts of money. Very recently, Investigator Cruz and I were doing a proffer down in New York City in a context where somebody got a fraudulent flu vaccine, and we couldn't believe it. They told us that they paid $1,000 for it. So a street value of $1,000, we say, in our experience, it's somewhere between $250 and $1,000, per vaccine, per dose. So these schemes, are big money makers. So that's Julie DeVono. She's the nurse practitioner, now former. That case was resolved with a plea agreement by Suffolk County. Suffolk County DA's office did a great job resolving it. She lost her license, both her business license and her medical license. She actually moved $1.2 million, over $1.2 million in forfeiture, criminal convictions, kind of the full Monty. Interesting. One kind of interesting part of the case that I don't think people realize or that hasn't been publicized. So this was where her practice was in Amityville. The front of the building, so she was in the back of that building. You actually had to go all the way around the block, and there was like a parking lot in the back, but it wasn't easily accessible. No signage. Just the kind of back half of what in the front on the street was a dog grooming business. And again, we understand there were literally lines out the door at times of people, trying to get the vaccine. And to their credit, there was actually a police precinct, a local police precinct to kind of catty corner to the parking lot. And my understanding is that that's really kind of where suspicion started, where a patrol officer. How these things happen, right? A patrol officer noticed this and it just didn't smell right. Like why, like what were they giving out over there that was attracting so many people through this random, strangely located medical practice. And then the investigation went from there. Suffolk County PD, sent undercover officers in and, recorded undercover buys of the fraudulent vaccination records. So I think that case is a great example of kind of the transition for our team from that COVID time to now, and a lot of work that we've done to date is around childhood vaccines, right? So what we saw was what we started to see was a lot of the same fraud that we had encountered and learned a lot about throughout the pandemic. Was also happening in the context of childhood vaccines. And so just a brief history on that in New York State and where that came from, based on our understanding in this area. Go for it. So in 2018, 2019, there was a nationwide measles outbreak, similar to some of what's happening right now. And that had a disproportionate impact in New York State, especially in Lower Hudson Valley and in the city. As a result of that, in June of 2019, legislation went into effect eliminating the non-medical exemption from public health law. So what does that mean in real terms? It means that for the first time in New York State, if you were sending your child to a public, private, parochial school, you did not have the option of sending them without vaccines, with a religious exemption, right? You had to get vaccinated unless you had a medical exemption to the vaccine. So you can understand that created, that left a large population of folks who were not vaccinated, who now either had to get vaccinated or their only option was to start homeschooling their children. Unfortunately, that creates a market for fraudulent vaccine records, for the creation of fraudulent vaccine records. That went into effect in the 2019-2020 school year. Starting early 2020, everyone involved in public health, had their attention 100% on the pandemic, on COVID. So this was something that, really wasn't addressed, even if it was understood, in the first couple years, in the first instances. But then, coming out of the pandemic, we were able to turn our attention to this specifically, armed now with the knowledge and the experience that we had, from our COVID vaccine fraud investigations. We started our bureau, and we kind of picked up right away a lot of the work that we had been doing in the COVID context. We started to do in the pediatric or school vaccine context. I mentioned this before, and this is really the strongest hook that we have with regard to any of these investigations. So it's the New York State Immunization Information History, system. And just, again, very briefly, this is a system administered by us where under state law, under public health law, anytime an individual under 19 years of age is vaccinated in New York State, the provider, the doctor, the nurse, is required to enter the information about that vaccine into this system. And so, again, this is a system that is prescribed by public health law. It's our system, administered by us. So anytime there's fraud with regard to NISIS and entering fraudulent data into that system, we have a very, very strong jurisdictional hook to investigate that and to pursue those cases. So going back to Wild Child, the DA's office, from their perspective, and this I think is, one of the things we were in the little write-up about this particular presentation was, challenges with working with law enforcement, and I think this has been a big one. From a law enforcement perspective, they were done with Julie DeVono, right? They had their pound of flesh. She lost her business, lost her license. In fact, was no longer in the state. Had lost $1.2 million. So, the DA's office kind of considered its work done. From a public health perspective, we didn't. We understood at that point that she had committed, the same fraud with regard to pediatric vaccines, and therefore there was, a continued public health concern where a large number of children were concentrated primarily in Long Island, at schools and would continue to be at schools, throughout their education, with fraudulent vaccination records without having actually been vaccinated, which creates obvious public health concerns with regard to communicable diseases, or vaccine preventable diseases. So we, at that point, took the case and kind of ran with it. Through painstaking investigative work, we were able to identify particular individuals who we were able to show, in fact, received the fraudulent the fraudulent vaccine records, and we deleted those from NICES. We worked with NICED, the New York State Department of Education, had the children excluded from school until they came back with authentic or genuine vaccine records. And we brought an administrative action against Julie DeVono, which is ongoing. A similar case that we did administratively was out of Nassau County. This was another midwifery, Baldwin Midwifery, administered fraudulent vaccinations, homeopathic alternatives to genuine vaccine. There's no such thing, to something like 1,500 children over a number of years. And she ended up paying us a $3,000 fine. She's banned for life from administering vaccines. My understanding is NICED. Remember, NICED is who licenses basically any medical professionals other than physicians and physician assistants. My understanding is that she subsequently, as a result of our case, lost her license. That case also, got a lot of attention. We got a nice write-up from the New York Magazine that did a deep dive into our work and into the facts of that case. This really has nothing to do with anything, although it's just kind of funny to me. We're out there like all day, like hitting the streets, and we see kind of funny things as part of our cases, and we just, are looking for somebody to share them with. So that's this. So here's Baldwin Midwifery. It was literally, similar to with Wild Child, this kind of hole in the wall in the strip mall in Baldwin, New York, Nassau County. And right next to it, didn't have anything to do with the case, was this travel agency, like kind of an old business model in and of itself, but it's called Trump Travel. And I just thought that this was hilarious. Like on their sign itself, they had to put this disclaimer that they're not affiliated with Donald J. Trump or the Trump Organization. This little hole-in-the-wall travel agency felt the need to make it clear that it wasn't at all affiliated with one of the most famous multinational corporations and individuals, regardless of your politics, in the world. So I thought that was funny. Again, another case very similar to what we've discussed. This one out of Western New York, just to prove that we don't do all of our work in Long Island and New York City. Again, another substantial fine, $55,000, approximately 115 children. This is somewhat a smaller case. Here, 9 counties affected, even with that small of a number. Thank you. Even with that small of a number, you see, how the public health implications of these cases, right? So people were coming from a great distance, as far as New York City, to get fraudulent vaccines from her. So, so these are serious cases from a public health perspective. Just, again, some of the face work or social media work we did, in the same time she was vaccinating, that particular practice was posting these very anti-vax messages, that were red flags, right? What are the chances that you're administering legitimate vaccines on the one hand, while at the same time you're posting about, purported connections between the Nazi Party and vaccines in America. This is definitely an area where we, will continue to do work as long as we have to, and where we're looking for partners. I think these cases are unfamiliar to most folks, especially local DA's offices. And that's really who we're looking to work with now, especially, because frankly, these cases are not going to be prosecuted federally under the current administration. That's just a matter of fact. So that's been shown. So we're looking for partners to work with us on these cases. They're unfamiliar. We understand that. We're experts on it. We would be happy to meet with anyone and do a deep dive. You could look at the findings in our STIP and orders. We, by design, we gave very specific, a lot of detail about the history, about how we, about our investigations, about the evidence in those findings. So I think any prosecutor, any investigator reading through those findings would get a good primer on what the investigative work around these cases looks like, what it entails, what the evidence would be. They're serious cases. The potential charges, forgery, tampering with public records, particularly in any case where the fraudulent information is being entered into NISIS, but also if that data, is then, or if those fraudulent records are then being given to public schools, you have that charge as well. Falsifying business records. We see a lot of forgery, so this is relevant to the healthcare community because we see a lot of cases where doctors, nurses, pharmacists, names are being forged on documents, and so you see a lot of that. And like we've talked about before, the big money cases, again, something like $250 to $1,000 per vaccine is what we understand the street value to be based on our investigative work to date. So you just take that and times it by however many patients. You think about with a standard child vaccine, the battery of vaccines that a child's going to receive in his or her childhood, something like approximately 10. So just take that, times it by 10, and the money quickly adds up. So obviously, there's practical concerns to the cases that that we bring, and what can we get out of them, and what are the dollar amounts, for better or for worse. I know we calibrate a lot of our cases, especially in a white-collar world, by dollar amounts, and the dollar amounts are there with regard to these cases. And then we have this resource. This is really designed for schools, but I think for investigators as well, it's something that you could take a look at to get a sense as to what we're talking about. This is a case that website we're really proud of, kind of first in the nation, but it's really kind of a clearinghouse for information in New York about childhood vaccine fraud. So all kinds of resources there that I would invite you to take a look at. All right, in the remaining minutes, I want to talk about a new area that we've recently had some success in. That's with regard to illicit sale and distribution of vape, a major public health concern. So just to give you a sense, I don't think anyone here really needs a primer on this. I'm sure I'm preaching to the choir, but this is really a very offensive industry that's targeting our children. This is a photo I took. This is actually not in New York. This is from Baltimore. It doesn't really capture here, but this is like on the window of a smoke shop. Really, at my level, it was at waist. So if you think about a child, that's at eye level. And it looked to me, for all the world, like remember when you used to get ice cream from an ice cream truck and they would have the display of all the different ice creams you could have? I mean, that's what it looked like to me, intentionally or otherwise. And then you look at the flavors: gelato, Slurpee, orange creamsicle. I mean, sour, what is that? I can't even read it. Sour something. But anyways, these are flavors that are designed to appeal to children, not to adults. In New York State, and there's really kind of a balkanized civil enforcement with regard to the sale of vape. That's or vape products, of cigarettes, which is problematic and really tackling this using traditional enforcement mechanisms. So traditionally it's exclusively civil. Our inspectors, or the inspectors who are doing these inspecting smoke shops, are not law enforcement officers. And it's really kind of different throughout the state based on where you are as to who in fact has jurisdiction or who's responsible. In our district offices, the Department of Health has jurisdiction. Those are the colored areas throughout this map. Everywhere else, in other counties, it's the local health department, and in New York City, it's the Department of Consumers and Worker Protection. So there isn't really any one entity that does this. And what we're finding is when we go into these smoke shops, they're now set up largely like like trap houses, right? It looks much more like a narcotics, what we would think of as a narcotics operation, than like a the sale of some kind of an actual legitimate product. So this is from our Oneonta office. You see they went into the back of a smoke shop. They removed these two doors that were standing up. Behind them was a hole in the sheetrock, and they were keeping their illicit, illegal product in there, just like what you would expect to find, in a drug house or a trap house. And in fact, here is this case was investigated by the AG's office and state police, but this was in a TUPA business that, our inspectors could have been going into. This is in Dutchess County, and they find drugs, they find guns, not the kind of place that you want to send, an unarmed, untrained inspector into, to sit there and count how many illicit vape products they have behind the counter. So one thing we've done recently is we literally did a deep dive into the public health law. We said, is there anything we can do criminally? What we found is that there is one criminal provision with regard to vape, and that says that it's illegal to ship vape in New York State. You cannot ship it to a retailer or to any unlicensed facility. So we took that and we ran with it. We said, okay, let's do this. Has anyone ever done this before? And the answer was no. So earlier this year, we found what we considered a triple threat. We were actually working with a local health department. This is a business that had brick and mortar locations in Cayuga and Cortland County. They manufactured their own vape e-liquid, and they also had a website where they would ship it. So it seemed like the perfect target for our initial run at this. You see, again, the products, obviously, the kind of things that would appeal to children. These are really addiction machines. A lot of the disposable vapes now have electronic components, the whole deal. And so there we go. We got the first, and this was advertised as and was in fact the first arrest under that provision of the public health law. We did undercover buys. We worked with Schenectady County DA's office and state police, and we were really proud of that arrest. But we didn't want to stop there. So then, very recently, earlier this month, we did what has been considered the biggest takedown or the biggest vape-related sweep in New York State history. We targeted 12 different entities in what we called Operation Vapor's Dozen throughout New York State, literally from Niagara County to Suffolk County. And we again worked with the Schenectady County DA's office, state police. Again, we're running out of time, but I think this really was a culmination of a lot of hard work, building relationships with state police, a lot of the work we've done. And this went extraordinarily smoothly and was a huge success. Within a week time, we arrested the owners and the businesses of each of these places where we had done undercover buys. There ended up being a lot of press around it. The governor's office did a press release calling it the largest criminal vape enforcement action in New York State history. And a marker of success, we see a lot of industry media reporting on what we did. So hopefully that will have a deterrent effect. Two of the businesses have shut down their websites, even with charges pending. And that's what this is. Shut down their entire New York and U.S. operations. And another place, next one, has shut down its website. All right. So what's up next? Very, very quickly. We want to do work in surrogacy. Human trafficking is a huge problem there, so we want to start looking at that. Abortion access, we have some stuff coming up, so stay tuned with that, but we really want to expand in that area. Med spas are a big thing. We feel like there's opportunities for collaboration with Department of State, B&E, and State Ed. There's also some stuff coming out that we've already done with regard to that. We want to go after wholesalers in the vape context specifically, and do seizures, big time seizures. And we want to eradicate school vaccination fraud entirely in New York State. We think we can do it, nip it in the bud, and that's going to continue to be a priority for us. And who knows what else? Like I said, by design, we're always looking for the next big thing or something that we can tackle and bring value to. All right, here's our contact information. So please feel free to reach out for intel, knowledge sharing, opportunities to collaborate or partner, yeah, people are doing exactly what I'd hoped they would do. I also have cards. I can leave them up at the table, but please reach out to us. Like I say, almost all of our success is the result of partnerships and collaboration and hard work with other sister agencies and sister bureaus. So we're big into that, and we welcome it. All right, thank you all very much. I appreciate it.